Good afternoon, and welcome to the City Club of Cleveland. We are having a debate in this country about healthcare reform. New terms like single payer system, public option, government control of healthcare, death panels, pre-existing conditions, employer-sponsored plans are no longer just the topics for the pharmaceutical industry, the healthcare industry, insurance companies, lobbyists, and legislators. These are things we are all hearing about and all talking about. And there's no place better to have a discussion about healthcare reform than right here at the City Club of Cleveland. My name is Jan Roller, and I am president of the club. The various interest groups on healthcare reform are spending millions and millions of dollars to shape public opinion. The final bill has not yet been written, and there are many competing proposals. The proposed reforms are complex, and this complexity is causing a lack of clarity and misunderstanding by citizens across the country. The confusion and a fear of change has caused rancorous and bitter confrontations at town hall meetings. It has also struck an ugly and at times hateful chord among some people, resulting in a suppression of free speech and eliminating an open, helpful dialogue on the topic. When a friend of mine heard that the City Club is sponsoring a forum on healthcare reform today, he said, "Keep ringing that bell of hope," meaning the gong that we ring to open each City Club forum. I thought that said it best, that here at the City Club, we hope that an open, cordial discussion with opportunities for questions from everyone will help dispel the confusion and promote a clearer understanding of the important topic of healthcare reform. Here to introduce our speakers is our moderator for today's panel, Dan Moulthrop of WCPN Idea Stream. Please welcome Dan Moulthrop.
Thanks, Jan. Thank you very much, Jan, and thanks all of you for joining us here at the City Club of Cleveland. Thanks also to our audience on WCPN and also on WVIZ. It's a real pleasure to be here and to tackle with these two fine congressmen an issue of really such importance. And because it's so important, I'm not going to waste a whole lot of time saying things that you already know about this debate and about these issues, and just get right to introducing our guests today. Congressman John Boccieri won election to the 16th Congressional District just last November, so it's my first opportunity to congratulate him. He's a major in the U.S. Air Force Reserve, served in Iraq and Afghanistan, and before heading to Washington, he served 8 years in the Ohio legislature. It's great to have you here, sir.
Thank you.
And also with us, Congressman Tim Ryan, the 17th Congressional District. He has represented that district since 2003. He serves on the very important House Appropriations Committee, and he previously also served in the Ohio State Legislature. These are the kind of guys, by the way, you add up their ages and they make maybe less than Ralph Regula. And they're the kind of guys, they're the kind of guys who, when you realize how young they are, they make you feel like a serious underachiever. But please give them a round of applause. So they each have about a few minutes to just lay out some of the terrain of where we're going to be talking about today, and then I'll have a few questions for them, and then of course in the second half of our program we'll open it up to questions from you. But Congressman Ryan, go ahead.
Well, I appreciate it, and first let me say it takes two of us to meet the standard of Ralph Regula, and I think John and I would both agree to that. Ralph was a wonderful member and a global member, took care of the whole state with his position on appropriations. I think it's important for all of us to, as we have this debate and we see what's happened this summer, is to try to put this into some context as to what the discussion has actually been like and maybe why it's been this way. And I'm not a particularly partisan person, but I think it's important as we hear the discussion to recognize that there was a Republican memo that came out very early on by Frank Luntz that said you cannot let President Obama pass health care reform. You must do everything you can to prevent this from happening. And then you had a Republican senator say that this needs to be Barack Obama's Waterloo. That is not exactly the way to start an important discussion about very important issues that are facing the country. I think in 2009, when you look at the trajectory of health care spending in our country, Healthcare spending is growing at 9%. The GDP is growing at 3%. So over the course of the next decade, 1 in every $5 will be spent on healthcare. Over the course of the next 30 years, 1 of every $3 will be spent on healthcare. That is an unsustainable position for our country to be in. And for us not to have the maturity and the recognition that this is an American issue, not a Democrat or Republican issue, and we can argue about the substance of how we get there, but I think it is so irresponsible to start this very important debate that way, because the average American family and the average American business, and we'll get into all the details of why we need to do this, but if we do absolutely nothing, the average family of 4 will have an $1,800 increase in their health care bill next year. And then it's not over. It'll be $1,800 or $2,000 the next year. It'll be $1,800 or $2,000 the following year, to the point where it's eating up the entire family budget. You can't invest in education. You can't invest in your home. You can't invest in anything else that you deem important. Same with small businesses. It's strangling small businesses. So as we begin this discussion, I think it's important for everyone to remember where I think most Republicans are coming to the debate and what their attitude is coming to the debate is. And it's important for us to recognize that, you know, it may be at some point, if they don't want to play in a fair manner and negotiate in good faith, that it may have to be the Democrats that have to pass this thing.
It's worth mentioning when you say that, Congressman Ryan, that the City Club invited just about every Republican member of the Ohio delegation to this forum, and they all declined our invitation. So,
you make my point.
Well, I'm just putting it out there. It's a matter of fact.
Yeah.
Congressman Boccieri.
Thank you. It's an honor to be here at this venerable institution and have the opportunity to have a robust dialogue excuse me, about health care and where our country is going. It's an honor to serve with Tim Ryan and have my predecessor, Ralph Regula, who has big shoes to fill in this congressional district, and it is just an absolute honor for a grandson of a coal miner and a carpenter to walk the chamber of our nation's government with gentlemen like Congressman Regula and all the delegation here. So this issue that we're grappling with right now, to echo some of the sentiments of Congressman Tim Ryan, is not a Democrat or Republican issue. It's not a conservative or liberal issue. It's a matter of America. It's in the challenges that we face here as a country. There are no two bigger issues that confront us for the long-term competitiveness of our nation than energy and health care. And Congressman Ryan suggested that we spend nearly 20% of our gross national product is based on health care. And they predict within the next few decades that it could grow to over half of our gross national product. And that is an unsustainable future for our nation's small business, large business, and every layer of government from the most local to the most federal. And we have got to do something. The cost of doing nothing is unsustainable. I remember the words of Teddy Roosevelt. He said, the worst thing you can do in the moment of a decision is nothing, is to sit around and watch the train go by. And this is something that we have got to uniquely tackle. When we start talking about the proposals that are on the table, these are ideas that we have come up with. These are ideas, the proposals that we have generated over a serious debate about where our nation's health and the viability of our nation long-term is projected. When you think about this, that we spend more than any industrialized nation in the world on health care, yet our life expectancy is on par with Cuba. There's no question that there's room for improvement. And I can tell you that this debate should start off as a collegial discussion about how we progress and not to what it has erupted to in the political spectrum. One thing to add, you know, folks out there who may be opposed to health care in terms of the expansion, the reforms that we're trying to undertake right now, think about this. When I was flying missions over in Iraq and Afghanistan, in 2004, our Secretary of Health and Human Services, Tommy Thompson, flew to Iraq with one of many billion-dollar checks in hand to make sure that every man, woman, and child in Iraq had universal health care coverage. Yet we have people in this country, 47 million uninsured or underinsured, who are facing every day with serious decisions about whether they put medicine in their cabinet or food on their table, about whether they see their doctor or whether they can have enough money to even drive to work. And these are serious, serious issues that we have to address in the most industrialized country in the world. So I'm happy we're having this discussion. I hope it's robust and a very necessary time to tackle this, one of our nation's biggest issues.
Okay, you both mentioned the fact that right now $1 in $6 of our gross domestic product is spent on healthcare. And within the next 30 years, 40 years, it could be, if we do nothing, it would be $1 in $3. Congressman Boccieri, what in the bill before your branch of the legislature, the H.R. 3200 is the one that's furthest along, what in there actually bends that cost curve? What changes things?
There's a couple of things, and one of the things that I think is most important is that we're driving people to see their physician, their primary care physician, because those uninsured and underinsured folks who don't have access to, whether they have a diabetic condition, whether they have asthma or a heart condition, they need to see their physician. Those are chronic diseases that can be managed well and save money. But when they lose their job and effectively get that pink slip, their health care ends because they can't afford the COBRA premiums that are often as much as their salary. And when they go into the emergency room now because they have a chronic condition that has festered to a point where now it requires immediate attention, they're costing all of us paying in the system 5 times more. So we have to, this bill helps end the notion of using the emergency room as a primary care physician. Number 2, one of the more controversial aspects is it sets up a public option by which there's competition with a menu option of prescribed access benefits and those sorts of things that's going to help drive down the cost potentially. And this is something new. It's a new concept in American debate, and it's something that
to be clear, we don't know that a public option would drive down the cost. We know that we hope it would. That's kind of what Congress, the operating principle there.
We're using the arguments of competition as an effect of driving down costs.
And I think
whose pocket does that come out of then, Congressman Ryan? If costs go down, who's paying?
Well, you're going to save a lot of money to begin with. I mean, let me first just kind of add on to that, and then we can certainly talk about how we pay for this. So you have the prevention. You basically have people getting screenings, catching cancer before they end up in an emergency room and need a mastectomy or whatever the case may be. That saves billions and billions and billions of dollars that we are all paying for now. It's all getting shifted onto your premiums. That's why your premiums and your costs and the small business people are getting strangled because the person going isn't paying. So now under this plan that we're talking about, that person who will be included and have coverage will be paying a copay. So that person who otherwise paid nothing and cost you a lot more will now be paying their fair share and costing you less because they'll be getting this preventative care. Also in Medicare, this is where I think we can save, again, a lot of money. We have people now, especially in communities like ours, Youngstown, Akron, Canton, Cleveland, where you lose your job and you're 55 or 60 years old, but you're not on Medicare yet. So we have, hundreds of thousands, if not millions of people who are in the situation that John just talked about, where they have COBRA or they're paying through the nose for their insurance, they don't get really good coverage. So what they say is, I'm not going to get insurance or I'm not going to get anything done because my insurance is not going to pay for it. I'm going to be in Medicare in 2 years. I'll wait until I get into Medicare. And by that time, these people are sicker. So part of this plan is you are going to have a healthier patient going into the Medicare program. And that is invaluable. You're going to save billions of dollars in that alone.
On the issue of preventive care and providing screenings for cancer is one thing you mentioned, screenings for diabetes, that sort of thing. The Congressional Budget Office says that, in fact, that may cost more than we would save. Because if you're screening 100 people for cancer, for colorectal cancer, and really only 2 of them are at risk, you're wasting a lot of money. What about that?
Well, the Congressional Budget Office hasn't really analyzed the preventative side of things. That's been part of one of the misnomers here, is that we're not going to save money. But
just to be clear, I read that in a letter from the director of the Congressional Budget Office. Not to me personally, but
I was going to say
to one of your colleagues.
You know him better than I do. That. He won't even call me. But there may be reasons for that too. I don't know. But I think common sense will tell you that these screenings are cheap. And okay, maybe, and I wouldn't cede the point, but what is the value to our society of preventing someone from having cancer? Don't we value that? that is something that I think as a country we need to recognize. And we have gotten to the point in this country where everything is, well, what's the bottom line? And that's how the insurance companies are running things right now. What is the bottom line? And if we have to tell you we can't cover you or we can't give you this procedure, we're not going to pay for it. And I think this can be a more compassionate approach to the delivery of health care.
Congressman
Let
Boccieri.
me just add something too. Congressman Ryan and I are here today standing up and saying, look, we don't want socialized medicine. We want a system that's uniquely American, one that fits our value, our culture, and our beliefs about a system that's going to help cover everybody. You know, when we think about the 47 million uninsured and underinsured folks, the folks who are underinsured, they move from transition from one job to the next, but yet they had a situation where they were diabetic. And that chronic disease now becomes a pre-existing condition. Mm-hmm. And they can't seek routine visits to their physician or buy the medical supplies that are necessary to help them manage this. And when they're blocked and denied and screened from seeing their primary care physician, that's costing us more money. So ending the idea of using pre-existing conditions as a discriminatory practice, I think in the long term is going to save us money. And Congressman Ryan's right. I mean, we screen people now for colorectal cancer, breast cancer, and we're going to save money in the long term because to manage that disease or that illness in years to come, the costs are going to increase. I mean, this has shown it. An average of family in Ohio right now is spending about $12,000 for their medical insurance, which is almost a 90% increase from the year 2000. This is an unsustainable track, and you know, we've got to be able to manage costs.
And one other point too, what's the loss in productivity of someone? I mean, a lot of times we don't even factor that in. We're doing the hardcore black and white healthcare numbers, you know, but this person now misses work for how long, you know, and what's that do to the work situation? I mean, those things all need to be factored in to this discussion.
This legislation does a lot. Insurance mandates for all Americans and then subsidies for the poor who can't afford it, removing pre-existing condition limitations and removing lifetime caps on insurance. Does it go far enough, Congressman Ryan?
Well, yeah. I mean,
well, I'm speaking to you.
Yeah. You know, it depends on where it ends up. I think, in my own humble opinion, I think with a public option, I think that would be, you know, in my mind, that would be as far as we can go at this point, and it may be as far as we need to go. And I think it's important that we do this in measured steps as well. No one's talking about Canada, no one's talking about, well, some people are talking about single payer, but that's not a realistic discussion. So this is where we are, and I think this is a very comprehensive bill that will bend the cost curve, will address the pre-existing needs and the subsidies and all that. I think it does go far enough, you know, and that's why you're going to see, I think with negotiations in the Senate, it's probably going to get pared back a little bit. But I think we want to make sure that we have a bold plan and that we negotiate from that point. And, you know, the key is for us to get something done. You know, when Social Security started, you know, the average age was 60 and you wouldn't get it until years later. It only covered your retirement. It didn't have disability and all of these other bells and whistles, but it was about getting it done and getting something in place. And I think that's my personal goal here is let's get something done that's substantive and can actually bend the cost curve.
Does that feel less ambitious than where you all began with this bill?
Welcome to our world. Yeah, I mean, to me, I'm, you know, when I heard about the public option, I was disappointed that people were talking about pulling it off. That's my personal opinion. But that's politics, you know. You take half a loaf, you can't get the whole loaf. You take what you can get, you know. If the defensive backs are playing back, you take the 5-yard out and you complete the pass and get back in the huddle. So
spoken like an Ohioan. Congressman Boccieri, where do you stand?
We want the Browns to follow his.
If only. Congressman Boccieri, what about the public option for you? If it's not really clear, I think, to anyone in America where the White House actually stands on the public option and how married they are to that as a piece of the legislation that's sort of a deal breaker for them. I know that for some members of Congress it is a deal breaker. If it's not there, they won't vote on it, members of your party. How do you feel?
You know, I'm very curious by that position too, because this is a new concept. It's not been proposed before in our public policy debate, and it's a little bit unclear about how it will work. I mean, it's an idea, and it's something that we ought to have a debate and robust dialogue about. But I think it's unclear to suggest that this is the only thing that can help us drive down costs. And I think that we've got to focus on the energy that we can create by working together. I mean, the consensus that we need to drive this decision through the Congress is something that cannot be more underscored. I mean, there are constituents in Republican districts that are affected by this. And I had a woman show up at my office a while back, about 2 weeks ago, who was suggesting that the doctor had asked her to have an MRI. And she knew it was quite expensive, so she went to an insurance company to find out if she could afford it. Well, the insurance company said, no, you're going to do therapy first. She did the therapy, went back to her doctor, and the doctor said, you still need an MRI. And she went back to an insurance company, they said, no, you're going to do an x-ray. Now, to me, that sounds like rationing of healthcare. That sounds like rationing. And you know, when we do the cost-benefit analysis, one of my guideposts for this legislation is, are we going to make certain that doctors and physicians are driving the decisions and not bureaucrats in Washington or bean counters in an insurance company? Physicians need to be empowered to do what they were trained to do. And my whole notion is that we have got to find a way that fits our uniquely American approach.
Okay. Physicians need to be in charge of decision making. You guys probably read, or you have staffers who briefed you on an article that was in the New Yorker by Atul Gawande about fee-for-service, and the highest Medicare costs in the nation are in McAllen, Texas, where you have a lot of doctor-owned hospitals, a lot of doctors in private practice. Each practice owns their own MRI or CAT scan or whatever machine, and so they order them all the time because they know they can convince insurance companies to pay for it, and they know Medicare will pay for it. How is that good? How is that example of doctors being in charge of healthcare decisions good for America if that's an example of a place where Medicare costs have gone out of control?
Well, let me suggest a own personal experience that I've had. We have a 16-month-old at home, one of our 4 children, 4 deployments, 4, you do the math. But anyway, we have
Congratulations,
thank you.
Congressman.
Our 16-month-old just had an immunization, and my wife comes running about midnight. I was answering some emails, and she said, look at this bill. It's about $360 for an immunization. And the insurance company was paying for about $30 of that. I said, well, what's our part of this? And then we read the fine print, and it said that this is all that the insurance company was going to pay. Now, that's 100% more, you know, than actual, you know, the bill. And so when I went out into our district, we were asking about why there is overcharging. You know, and the folks who are in the industry said that this is a result of the system that we have right now, where we have to overcharge so that we can get reimbursed a certain amount of money that we know that we can sustain our own operating costs. And
so they pump up costs because they know Medicare is only going to pay half of it, say, hypothetically, and a private insurer is only going to pay maybe 70% of it, so it's all just cost inflation.
Well, this terrible system that we have right now, where we have to overcharge to get a small amount of payment, and then, you know, have the patient fill in perhaps a percentage that is not working well. And to me, I think it should be a contractual obligation. We know how much an office visit costs. We know how something as simple as an immunization should cost, and it should be, you know, you make the treatment and then you make the payment.
Mm-hmm.
And we have some reforms in here. Again, the key here is to reward doctors and pay docs for increasing the health of the patient. That's how they should be rewarded. We shouldn't have a system where they get rewarded for having more tests. And at some level, that may we need to address liability issues as well. And I think that's something
Tort reform.
That, well, however you want to put it. You know, I mean, that's what we need to do, is make sure our docs feel like they're not going to be, they're going to have to increase their own expenses and the expenses of the patient and the expenses of everyone else who's paying for it in order to, you know, cover their own rear ends for those kind of situations. But also in here, and I, you know,
but that piece is not in. There's no liability reform.
We're actually having a discussion in our caucus this week about, you know, what's going on with the liability issues as well. Again, this is a work in progress. There's 3 different versions in the House. The Senate's got a couple. I think at least, you know, the Senate's got 100 different versions of health care reform. And within our bill too, there needs to be a reform of the physician-owned hospitals as well. And we have some reforms in the bill, and I believe it's you can't own more than 2%. Not sure if you can do a lot of referrals to your own hospital, those kinds of things. So if you have that reform in there as well, a lot of what's happening in Texas could be prevented. And also, I think there was another area of the country, I can't remember, too, that was doing the same thing. You could see how it becomes a little bit of a cultural thing, in this little community, everyone says, oh, you're making a buck on this, how do I do it? You know, those kinds of things happen too. So we need to provide the proper oversight of the system as well, which isn't happening right now.
Can I ask you guys a process question about how many lobbyists have been knocking at your doors lately? I think people don't understand how the sausage is made in Washington and who's bending your ear. And I'd love to know, like, who's been stopping by to see you, and who's been writing who's been making campaign contributions over the last 3 months as this has really heated up.
You know, I think Congressman Ryan and I both invited all those lobbyists to a town hall meeting, and we'll see if they show up.
We have
Telephone town hall.
670,000 lobbyists apiece. You know, I don't take insurance money. I may have taken $1,000 over the course of my entire career from insurance companies. That was a thing I really didn't want to get into for a variety of reasons. But they are obviously very, very concerned with what's going on, people who are benefiting from the current system. But I have to be honest, maybe a couple, I can't think of any off the top of my head, who've actually stopped in to, you know, really push one way against it. It's amazing, you know, what's been amazing has really been, I try not to watch too much TV, but I do turn on and I see these town hall meetings. And you see
Not too many have looked like this one.
Yeah, no, they don't, and
Yeah.
that's all right. But the vibe, the feeling, the approach that I get when I'm at the Warren Italian Heritage Festival on a Saturday night, you know, is so much different than what I see on TV. We had a Democratic Party fundraiser last night at Mill Creek Park. There were about 200 or 300 Delphi people who have lost their health care, lost their jobs, saying we need health care. The one lady actually took a picture with my cell phone. She had a sign that said, old enough for a heart attack, not old enough for Medicare, need benefits. And those are the people that I see every single day, and it's so disconnected from what I'm watching on TV. I can't. I go on to a pretty right-wing talk radio host locally, who's like, "Don't you hear these callers?" I'm like, "This is the only place I hear this." You know, your 15 callers or 20 callers that get really upset and think yelling at me is somehow going to solve health care in America, are the same people that get on the Vindicator.com website and post comments underneath it. And are the same 15 people or 20 people that, I'm not saying that there aren't people opposed, but there is an anger in a very small group. And then most people I talk to have concerns, want to have a conversation, want to talk about it, but I think there's just a complete disconnect with what we see on the news and what people are feeling. I think.
What did you hear in your town hall, your telephone town hall this week?
I heard a lot of the traditional questions about, does this cover illegal immigrants? The answer is no. I heard about euthanasia, Sarah Palin's death panel, you know, which of course is that's nothing but a provision where if the patient initiates a conversation with their doctor that they want to talk about hospice, they want to talk about a living will, that Medicare will reimburse the doc for that conversation. But the patient has to initiate it. That now has turned into, you know, euthanasia. We're going to just push, and like my mom's on Medicare. I'm like, hey mom, you know, we had a good run. It's been good, you know. But, sorry, Washington has changed me, mom. You know? I got Potomac fever. You know? It's like, it's ridiculous. You know, my aunts, my great uncles, I mean, my grandparents. I watched both of them pass away before my very eyes, and watched them on Medicare be able to have health care. I mean, it's just ridiculous to think that we would want to do something like that. And so these people have consistently said that it's strangling my small business. One guy we had at a roundtable about a month ago, he closed down his lawn and garden shop, 15 people, because he couldn't afford health care, just shut the business down. Said, I'm not going to have a business where I can't give health care to my employees. And a lot of Delphi retirees who have taken a buyout, were promised health care and a pension, and now they're 60 years old and, don't have health care. Machine shops, I can go through the list. Amweld Steel Door, Youngstown Steel Door, right down the list. We see it, we read it in the paper every single day. These are the people who need help. And the news was there at the fundraiser last night. I said, people ask why we need health care reform now. I said, there's 300 reasons.
What about you, Congressman Boccieri? You got a lot of lobbyists lining up to see freshman congressmen from the 16th?
Ralph Regula's replacement.
We've had.
Where's Congressman? Where's Ralph?
Yeah, we've had some conversations with them, obviously about how this is going to affect our district and whatnot. But I think the president has said it best when he said, "Fear is not a tool of leadership. Fear is a tool of the status quo." And what we've seen in the debate right now is that you inject an effective political tactic, is inject all this doubt, inject all this conjecture that drags down the discussion to a point where we're not even talking about the real issues, we're not talking about the bill, we're not talking about the substance of the argument. And I have grown increasingly frustrated that we're having to defend these types of discussions, what the Congressman Ryan was talking about, rather than talking about the substance of the bill. The fact that we're proposing a new idea for America, and let's have a debate on the new idea and the proposal, rather than talking about death panels and just unbelievable. And for someone who hasn't been in politics all that long, I think this has been an awakening for how these types of movements begin. And I mean, look, they are real people. They're real Americans. They're real Ohioans who are expressing their frustration. Perhaps it's a much larger issue. They're focusing on government as a whole, and they have the problems with that. But it's transcended this debate into something that I think has been very harmful for the issue as a whole.
Congressman Boccieri and Congressman Ryan, let's we're going to pause for a moment. Jan Roller's going to offer some mid-program announcements, and then we'll begin the traditional questions from the audience. Jan.
Thank you. Today at the City Club of Cleveland, we are listening to Congressman John Boccieri of Ohio's 16th District and Congressman Tim Ryan of Ohio's 17th District, and moderated by Dan Moulthrop of WCPN Idea Stream. We will return to our speakers in a minute for the traditional City Club questions. We encourage you to formulate questions for our speakers now and remind you that your questions should be brief and to the point. We welcome all of you here and those listening to WCPN 90.3 FM, WCLV, WTAM, and one of our many radio stations across the country. Radio broadcasts of the City Club are made possible through the generous support of Case Western Reserve University. Our television broadcast partners are WVIZ, PBS Idea Stream, and Time Warner Cable. Television broadcasts are supported by National City, now a part of PNC, and Cleveland State University. Closed captioning is supported by Nordstrom Corporation. Our webcasts are supported by the University of Akron. Today's forum is the Herbert and Nettie Borstein Endowed Forum, which recognizes a generous gift by the Borstein family. Endowed forums are one of the many ways we keep the City Club strong and vital. If you share the Borstein's commitment to civic engagement, please consider learning more about how you might endow a City Club program. Also today, we are pleased to welcome guests at tables hosted by Baker Hostetler and Medical Mutual. Thank you for your support. Now we would like to return to our speakers for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphone today is Assistant Director of Development Marcella Brown and Education and Outreach Coordinator Deborah Agasti. Now, first question, please.
Gentlemen, I appreciate your taking on a very tough issue here. I want to give some personal experience that leads to my question. For 40 years, I was a subscriber to the Kaiser Permanente health plan here in Cleveland, which I very much appreciated for two specific reasons. One is it aimed to keep me and my family healthy, and number two is I almost never got a piece of paper that was a bill from them because the system was integrated in a way that I didn't have to deal with anything but pay insurance premiums or maybe small copay. When I had to leave that plan because my insurer or my employer dropped it as an insurance option and had to go to a more traditional insurance plan, I found two significant problems. One is in finding new providers, they were used to dealing with people that were ill, not healthy. So when I had an appointment with a a general practitioner recently for a minor problem. She even said, "It's nice to see somebody healthy for once." That's a very poor comment on how our system works, obviously. Secondly, I now get 3 different insurance plans sending me, or providers, Medicare for my wife, a supplemental policy for her, and another one. On almost every medical activity we have, I get 3 different providers sending me paper about what is owed on the procedure. Obviously very wasteful. Is this reform changing the system in a way to emphasize healthiness in all aspects, not just in screenings, and particularly public healthiness, exercise, losing weight, not smoking, et cetera, all the things we know will save money? And 2, is it doing anything to change the integration of the billing practices so we could get to a system that would be easier for me as a consumer and the companies to deal with?
Thank you very much for that question. Congressman Ryan?
Well, yes and yes. There's a number. Right now, we spend about 4 cents of every healthcare dollar on prevention, and we're trying to get a lot more of the healthcare spending put up front. We eliminate co-pays for prevention in Medicare. We don't want any co-pays in the basic health plan that we're going to put together. So basically, we're going to put a group of people together, the Surgeon General, docs, and other people who have an interest, to set a basic plan that every insurance company who gets into what we're calling the exchange will have to, at the bare minimum, have this basic plan. And we have a group of experts that are now analyzing and will continue to analyze best practices in wellness, and therefore determine what preventative measures, wellness, those kinds of things will be covered in the different plans and in the basic plan. I also think, and I'm not sure if it's in here clear enough yet, but I also think patients should be rewarded too as well. We said earlier about paying doctors for increased performance and increased health of the patient, but I think the patient should also be rewarded. If you're exercising, if you're putting the time in to take care of yourself, as you obviously have, that you should be rewarded in some way with discounts and credits, or I don't know exactly how it should work, but there should be some incentive for that as well. And I know there's a consistent review of practices within administering, and because there is so much duplication, and especially now if you do have a public option and you have Medicare and you have all these different things going on. So I know there is I don't know if it's a panel. I get scared to say even panel, even if I don't put death before it anymore. So it's like,
commission?
Very good. We have a commission we're putting together that will analyze basically the process of administering the health care plan and do our best to continue to streamline it.
Congressman Boccieri, you want to add to that?
Just a quick comment. You're one of the lucky ones, sir. I mean, 11% of Ohioans are uninsured right now, and 64% of those 11% uninsured have one person who's working in the family. And that is a significant statistic in my opinion. Prevention has to be a part of this discussion. We have to have, no pun intended, skin in the game. And we've got to make certain that we're doing all that we can to promote health, wellness, nutrition, diet, exercise, those things that are very integral in making a well-rounded patient. And this fee-for-service system that we have right now needs to be reformed and modified, in my opinion.
Thank you very much.
Gentlemen, I still consider myself an Eisenhower Republican, but
You're the last one.
whatever. But I am still so for the health plan, any kind of a health plan, that it's not even funny. In fact, I think it's so important to the country that I consider it treason for these people to be talking against it, where the 45 million people are uninsured, and it probably led to the part of the uncompetitiveness of General Motors and Chrysler. Don't you think you can get any kind of a health plan passed, and then if it needs to be improved, it can be done so later? Thank you.
Thank you. I think the President was very clear about what his 2 most important guideposts were, and that was reducing costs and making sure everybody has access to affordable health care. I've expanded that to make sure that we not only cover all people, that we have portability so that folks can take their insurance from job to job to job, to make sure that we emphasize prevention, physicians, not bean counters or bureaucrats making decisions of health care, and that we end this notion of pre-existing conditions. The last issue, perhaps the most controversial one, is how do we pay for this? And what are the costs? There was an article that came out in April, I believe, and it was by the Associated Press, that said of the $2.5 trillion that we spend on healthcare every year, one-third of that money, almost $1 trillion, never reaches the doctors or patients. It's lost somewhere in the system. And while some may say, well, that's highly inefficient, there are others who are saying, well, that's how we butter our bread. I mean, these are jobs. You know, Ohio has a big insurance presence in the state. And one of the things that Congressman Ryan was talking about was this notion of tort reform. Well, the issue is that we don't have a nationally regulated insurance industry. Our insurance law ends at the state border. And you know, it's hard to get a cookie cutter approach to fit each component of the country. And I think that's got to be part of this discussion and I think as we progress, we will see that throughout this debate.
What about his question that can't you just get something through and work out the details later? I mean, you have colleagues in the Democratic caucus who have said if there's no public option, I'm voting no. Would you, as he suggested, convince them to do otherwise, just so you have a fix that you can work on?
You know, I don't think anything's ever, you know, you say no because you want the public option in there, and you see what happens. I mean, I've seen this, you know, in my 7th year now. I've seen Democrats and Republicans, no way, I'm not voting for that, that's not going to happen. It'll be a cold day in hell before I vote for that. Hey, how'd you vote? I voted yes. You know, I mean, it was the best deal you could get. So first, you know, it was in jest saying that, you know, an Eisenhower Republican is here, you know, and I want to hug you. I really do. And I say it, you know, to be funny, but the fact of the matter is, you would not fit in Washington, D.C. as a Republican, because we don't have Ralph Regulas anymore. They're you know, the last of the moderates have left. David Hobson, Ralph Regula, Ray LaHood became secretary of, those were moderates who said, you know what, we got to watch spending, but we need to invest in our roads, we need to make public investments in health care, but we don't want to overburden business and tax them too much. You know, there was a balance in there, but that is not there. What you're seeing now is people saying this needs to be Barack Obama's Waterloo. That is not, that makes it very difficult to pass something that has bipartisan support. And then the other argument is, well, here come the Democrats are going to ram something down our throats. I think we are going to pass something, but my concern is, what if we don't have a public option? What if we say everyone's going to be covered and we're going to put a surcharge on millionaires and pay for these credits so people can have some subsidies to afford it? And so now we have another 50 million people that we're subsidizing to go into the health care, to go to the private insurance market, and we don't do anything about costs. I mean, talk about wanting to buy stock in insurance companies. My God, they're going to have another 50 million people coming in with no cost controls. That to me is I hate to say it, but it may be worse than doing nothing. The concern with doing nothing, though, is we can probably get something passed on pre-existing condition. We can probably get something passed on quality of care. You know, we need to do something about having standards, best practices among docs so that we can start dealing with the liability issue where both sides can maybe agree on that. But I think we will get something done. But I am very pessimistic that there will be one Republican who will go along with it.
Okay, let's take our next question.
Gentlemen, great to have you here today. Actually, I really have 5 questions, but you said make it short. You said you're going to cover all Americans, but Congress is not covering itself. How hard will you fight to cover Congress? You said the health care costs are going up, but how hard are you going to fight for tort reform? And what about, you know, government's gotten into health care, and that is part of the problem for increasing costs. Then this idea of pushing things so quickly. There are unintended consequences. How are you going to be sure that we're still leading the world with new medicines and new technical procedures?
Okay, those are 3.
I counted
Yeah,
4, but that's all right.
Can I get tickets for Jimmy's return party? Oh, that's over with.
Okay, all right. Thank you, sir. John Boccieri.
Well, I would agree with the notion that having it all doesn't mean having it all right now. In terms of maybe the proposals that we've outlined, we got to find consensus on this. And as I said, I hope and pray that we'll be able to bring some Republicans along the board. You know, there are things in the bill that I have concerns with too. There are things I like and things I dislike. But at the end of the day, we've got to find a way that we can all come together as a country. And this is not a challenge that should be reflective of party line. I think too often we think about things in terms of the next election. Well, what's this going to do for me in 2010? What's this going to do? Instead of thinking about the long-term competitiveness of our nation, because costs are unsustainable. That's universal agreement from folks who are in the medical profession to folks who are outside of it are suggesting that this is unsustainable, the track we're on.
Well, how much of the timing has to do with getting this done before you all have to start campaigning for re-election?
Oh, that has nothing to do with it. No. You know, I think in part, you know.
Tim started next year. I started right now.
Yeah. In part, you know, there's always politics that come into play, and we saw it. You know, why you need to get something done and have some time to discuss it with your constituents before an election, because we've just spent a month and a half or 2 months talking about death panels and covering illegal aliens, and it's not even in the bill. In fact, there's stuff in the bill that says complete otherwise. So, you know, you need some time before you go back to your constituents for re-election to talk about it. And I think that's a reality of our system. And I don't think it's necessarily a bad thing to say it. And again, there are people who, you know, we get calls every single day, and you know people every single day that have to deal with fighting their insurance company. People are tired of that. They want something done, and they want it done now. And why are you jamming it down our throat? We've been trying to do this since Franklin Roosevelt was president. I mean, there have been, I think, 60 or 70 committee hearings in the House in different forms about this topic, and you're going up against right now a party that President Bush was the head of that vetoed the children's health bill that only covered 10 million kids. He vetoed that. So how are we going to have a discussion about covering everybody? We couldn't even get agreement. We couldn't even override a presidential veto on getting health care to 10 million kids. That's the kind of polarization that we have. And just to answer, I think it was your first or second question, you know, I have said that if there is a public option, I will drop my federal employee coverage and I will go into the public option. I am that confident that it is going to be successful and it's needed. I will get into it. Now, I'm not married, so it's easy for me to say that. My wife, or future wife, or if there's a future Mrs. Ryan out there somewhere, may not agree with, you know, being in the public option. But I think it is going to be a good system. I think it's going to work. I will go into the system. But what we're in essence trying to do is trying to give every American the same kind of health care that we have, where we have, I don't know how many different plans, 7 or 8 different plans that we go into and pick what we want and then pay, you know, for better coverage or less coverage. We're trying to give that same choice to the American people. And if you make, under the current plan, if you make under $80,000 a year and you're a family of 4, you're going to get some help. You're going to get some subsidy. And the closer you get to Medicaid, which we expand to 133% of poverty, the more of a subsidy you'll get. And so we want people to be able to afford it. And again, they will have copay. They will have skin in the game. They will have to pay their premiums. But right now, we're not getting anything out of those people. And I think when you talk about where we're getting some of this money, the people that are going to the emergency rooms will now be paying and will now have skin in the game.
Thank you, sir.
The American public is confused as to what is going on. On the one hand, it's said that we have to cover these people who are not covered by insurance. We know that's going to cost a lot of money. On the other hand, you say we have to save money so we can sustain it economically. How do you resolve this very real conflict?
We're paying for them now. Those people are costing us a hell of a lot of money. They go to the hospital in the emergency room. They're way sicker than they need to be. The doctor doesn't get paid, the hospital doesn't get paid. So when you go in with your insurance card and your coverage, they're procedure is reflected in your costs of your own health insurance. It's being pushed from them and the hospitals and docs onto people who now have health insurance. And so where we're going to save money is by investing in the front end and giving those people prevention. That's how you're going to save a lot of money. And we're going to ask people who make more than $1 million. I mean, and who knows where it ends up, but we're asking people who make more than $1 million a year to pay a surcharge in order to help us do this. And they have done pretty well over the course of the last decade, and I think it's fair enough to ask them to help us. But again, they're already paying for these people.
But this current proposal isn't deficit neutral.
Why not?
Well, according to the Congressional Budget Office.
Well, and again, in their analysis, they have not this is the Congressional Budget Office, which is totally nonpartisan and have kicked our butts as Democrats with our proposal, and the same with Republicans on different proposals that they have. But in their analysis of our health care bill, they did not factor in prevention. Now, how can you have an honest analysis of what we're trying to do and not factor in prevention? Yeah, we got 50 more million people coming in to the healthcare system, and we're not going to account for the fact that they're going to have preventative care. We're not going to account for the fact that we're going to have incentives for wellness and pushing the system towards a more wellness-based system.
So is there $200 billion or $230 billion worth of savings in preventive care and wellness and all of that?
Well, there's about $500 to $600 billion over the next decade in savings. Think about how much Medicare will save if everyone from 55 to Medicare age has health insurance. Instead of waiting to dump all of your care and your costs onto the Medicare program, you're going to get these screenings, and you're going to catch cancer early. All of these things are going to save Medicare a boatload of money too. So all of this comes together, I think, in a very comprehensive way. And the same, this isn't, and we have this conversation. We're talking about healthcare. We need to talk about the kind of food we eat and the kind of stuff that we're feeding our kids. We need to talk about pop in schools. I mean, this needs to be a health and wellness education among our young kids, the lack of exercise among our young people. I mean, all of this needs to be part of the national
You
discussion.
going to take on the Farm Bill next?
We already did that, so we need 5 years in between that. But we made great strides in that with the food stamp program and a lot of other investments into healthier food, new reforms at the FDA. These are all part of, I think, what needs to be a comprehensive plan on this.
Let's take another question.
Gentlemen, I thank you very much for coming here today. I'm no constitutional scholar, certainly not as learned as you two. As you know, the Congress is limited in the activities it can undertake by the Constitution. Some 18 duties that the Constitution gives Congress to do, and no more. Which of those duties would be covered by the institution of your public or government option?
I don't know that we have a constitutional expert to answer that. We'll maybe defer to the Supreme Court. But I will say this, sir, broadly, is that government has the opportunity here to set the goalposts, to set the out-of-bounds markers, and let the free market work in between. And whether you're talking about the Commerce Clause in the Constitution, or you're talking about the duties prescribed by Congress to set those goalposts for the opportunity for the free market to engage freely and cover everybody, I think that is more of the position that we would want to take. I don't think that Tim Ryan or any other member of Congress who are sitting here or who will discuss this issue want to go into each individual plan and set the rates. It's going to cost $50 for a hospital visit or $100 for an immunization. We don't want to do that. We want to let the free market do it, but we want to make sure that these guideposts and principles are covered. And maybe the idea that we have on the table in the House of Representatives needs a little bit more work. Maybe there are others who argue that we haven't gone far enough. But broadly, I think we need to set the out-of-bounds markers, set the goalposts, and act as a good referee and throw the flag when folks move out of that position.
Can we get another?
I
No more questions. I think we're done with the questions for now. We are done with questions? Apparently we're done with the questions. Thank you very much. Please, a round of applause. Thank you for the round of applause for Congressman Tim Ryan and Congressman John Boccieri.
Today at the City Club of Cleveland Forum, we have been listening to Congressman John Boccieri of Ohio's 16th District and Congressman Tim Ryan of the 17th District, and moderated by Dan Moulthrop of WCPN Idea Stream. Thank you, Congressman. Thank you, Mr. Moulthrop. Thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.